Tonight, before you go to bed, I want you to do one thing. Walk into whatever room your dog sleeps in, the bedroom, the living room, the hallway, and just look at them. Look at the position they've settled into. Because what I've learned over 22 years of veterinary internal medicine is that position isn't random, it's information, and sometimes it's the only information your dog is able to give you. I want to tell you about a patient, a 7-year-old golden retriever named Biscuit. His owner, a retired school teacher named Marlene, brought him in on a Tuesday afternoon in October. She wasn't worried exactly. She said he'd been sleeping more than usual, curled tight into a ball near the radiator, even though it wasn't cold yet. She thought he was just getting older. That's what I hear a lot. He's just getting older. I pressed along his abdomen. Biscuit flinched. Not dramatically, just a small, quiet flinch, the kind a dog gives when they've been hurting for a while and learned not to make a fuss about it. His spleen had a mass on it the size of a tennis ball. It had been growing, quietly, for months. The sleeping position, tight curl, body protecting the belly, was one of the first signs. Not the only sign, but one I wish Marlene had known to watch for. She asked me afterward, sitting in my exam room with Biscuit's head in her lap, "Is there anything I could have done differently?" I told her the honest truth. Maybe not, but knowing what to watch for could have gotten him in front of me 6 weeks sooner. And 6 weeks, in cases like Biscuit's, can mean everything. By the time you finish watching this, you'll know exactly what your dog's sleeping position can and cannot tell you. Which positions are normal, which ones are your dog's quiet way of saying something hurts, and what I want you to do starting tonight. Here's what most people don't understand about how dogs sleep. Dogs don't choose their sleeping position the way you and I might fluff a pillow and get comfortable. Their nervous system chooses it for them. Think of your dog's body like a thermostat and a pain reporting system running at the same time, always calibrating, always adjusting. When everything is working correctly, they sprawl. When something is wrong, temperature, pain, breathing, anxiety, the body pulls inward, curls, guards. The sleeping position is the thermostat reading. It tells you what state the body is currently in. There's a concept in veterinary medicine called postural guarding. It means that when an animal experiences pain or discomfort in a specific area, the muscles surrounding that area will contract to protect it, even during sleep. Especially during sleep, actually, because the conscious mind isn't overriding it anymore. A dog with abdominal pain will curl to compress and protect the abdomen. A dog with joint pain will avoid lying on the affected side. A dog with a breathing problem will elevate their head and neck to keep the airway open. These aren't behaviors, they're reflexes. The body doing what it was built to do without asking permission. And if you know how to read them, your dog is telling you something every single night. Your vet isn't wrong to not mention this during a routine checkup. They're not hiding anything. They just don't have 30 minutes to walk you through every behavioral signal your dog might produce between now and the next appointment. That's the gap I want to close. I've spent 22 years as a veterinary internal medicine specialist. I've operated on thousands of animals, held some of them through their final moments, and stood across the exam table from owners who couldn't understand how it got so bad so fast. What I can tell you is that the answer, more often than not, wasn't a missed test or a wrong diagnosis. It was a missed signal. Something the owner noticed but didn't know how to read. That's what keeps me up at night. That's the only reason I make these videos. So, let's talk about what your dog's sleeping position actually means. The side sleeper. Your dog is flat on their side, legs extended, completely relaxed. Maybe twitching a little. That's active dreaming, by the way, which is a whole other conversation. Side sleeping is the position of a dog who feels completely safe. The belly is exposed, the limbs are loose, and the body is fully surrendered to rest. From a clinical standpoint, side sleeping tells me that breathing is easy, joints are comfortable enough to extend fully, and the dog is not in any kind of protective posture. When I see a dog who used to sleep on their side suddenly shifting to a different position, especially a curl, I pay attention. That shift is often the first visible indicator of a change in how the body feels. If your dog has slept on their side for years and recently stopped, write that down. Tell your vet. It sounds small. It isn't. Now, the curled position, nose tucked toward the tail, body wound into a circle. This is the one that has the most nuance, and the one I most want you to understand. Curling is normal in cold weather. Dogs curl to preserve body heat. It reduces exposed surface area, exactly like pulling a blanket tighter around yourself on a cold night. That's not a signal, that's physics. But a dog who curls in a warm room, or who curls consistently even on warm surfaces, or who curls more tightly than they used to, that's different. The tight curl is the body's way of guarding the core. When I see it in a patient without an obvious temperature explanation, I'm thinking about two things: abdominal discomfort or anxiety. The abdomen, stomach, intestines, spleen, liver sits in the core of the body, and when something in there hurts, the dog instinctively contracts around it. I've seen this in dogs with undiagnosed gastric ulcers, pancreatitis, splenic masses, even early liver disease. The tight curl was there weeks before any other symptom. It doesn't mean your dog has any of those things, but if your dog has recently started curling tighter, and you can't explain it with the temperature in the room, I want you to mention it at your next vet visit. Don't wait for the next annual. Call and ask. Have you ever noticed your dog sleeping curled more tightly than usual and assumed they were just cold? Tell me in the comments. I read every single one, and sometimes what people share there leads directly to the topics I cover next. The sprawl. Belly down, legs spread out behind like a little frog, sometimes called the sploot. I've heard that word more times than I care to admit. The belly-down sprawl with legs extended backward is a cooling position. The belly is the least insulated part of a dog's body, and pressing it against a cool floor pulls heat out quickly. It's smart. Dogs figured this out long before air conditioning existed. In a warm house, on a warm day, the sploot is nothing to worry about. But here's where I want you to pay attention. A dog who sploots frequently when the room is not warm, or who seems unable to get comfortable even after switching positions several times, may be dealing with something else. Overheating that isn't explained by ambient temperature, fever, infection, metabolic disease, can drive the same behavior. A 7-year-old beagle named Rosie came into my clinic last spring because her owner, a man named David, noticed she'd been plastering herself to the tile floor at night even with the AC running. Her temperature was 103.8. She had a urinary tract infection that had begun to track upward toward her kidneys. The floor cooling behavior was Rosie telling David, in the only language she had, that her body was running too hot. He brought her in because he paid attention. She was on antibiotics within 24 hours and recovered completely within a week. That outcome was entirely because of what David noticed at 11 o'clock at night in his kitchen: the elevated head position. This one I want you to take seriously. A dog who consistently sleeps with their head elevated, chin propped on the edge of a couch cushion, paws stacked under the chin, head up rather than resting flat, is often doing so because lying flat makes breathing harder. When the head is elevated, the trachea, the airway, sits at a slightly more open angle, and the lungs don't have to work as hard against the weight of the chest, pressing down. I see this posture most commonly in dogs with early congestive heart failure, dogs with fluid beginning to accumulate around the lungs, and dogs with laryngeal paralysis. That's when the vocal cords stop moving properly and the airway narrows. These are serious conditions. None of them are death sentences when caught early. But they do require a vet's attention, and they do progress quietly. If your dog has begun propping their head to sleep when they didn't used to do that, especially if you've also noticed any exercise intolerance, a cough that sounds wet or soft, or breathing that seems slightly labored at rest, I want you to call your vet tomorrow morning. Not next week. Tomorrow. A 12-year-old Cavalier King Charles Spaniel named Winston came in through an emergency referral 2 years ago. His owner had noticed he'd started sleeping with his chin on the armrest of the sofa, which she found adorable and photographed multiple times. When Winston started coughing at night, she brought him in. His chest X-ray showed early pulmonary edema, fluid around the lungs, which is a hallmark of congestive heart failure in cavaliers who are genetically predisposed to it. We started him on medication immediately. Winston is still with his owner today, managing well, walking his neighborhood every morning. But his owner told me something I think about often. She said, "I had pictures of the warning sign on my phone for 3 months." Not blaming herself, just being honest. She didn't know what she was looking at. Now you do. Back sleeping, fully on their back, paws in the air, belly completely exposed. I love seeing this in a patient's history because it almost always means the dog is deeply comfortable, joint pain is minimal, and the dog trusts their environment completely. The exposed belly is vulnerable. A dog doesn't expose it unless they feel genuinely safe. From a clinical standpoint, consistent back sleeping also suggests the dog can breathe easily in any position, which tells me the respiratory system is working without strain. The only caveat I'll mention, a dog who suddenly starts sleeping on their back when they previously didn't and also seems restless, excessively thirsty, or has a distended belly, that combination warrants a vet call. Cushing's disease, which is a hormonal condition involving the adrenal glands, can cause dogs to sleep on their backs because the enlarged abdomen is simply more comfortable that way. It's not the position alone, it's the position plus the other symptoms together. What I want you to take from all of this is that no single sleeping position on its own is a diagnosis. Not one. What I'm asking you to do is pay attention to change. Your dog's baseline is your most important reference point. If they've always curled, fine, that's their baseline. If they've always slept on their side and stopped, that's a change. Change is the signal. Change is what I'm trained to look for in the exam room, and it's what I want you to look for at home. You see your dog every day. I see them once a year, maybe twice. You are the most important diagnostic tool your dog has. Every single thing I've shared with you today works through the same fundamental idea. The body communicates through posture. Pain causes guarding. Discomfort drives compensation. And when the conscious mind is asleep and no longer managing the performance of wellness, the body tells the truth. The sleeping position is the truth. Side sleeping, curling, sprawling, head elevation, back sleeping, different doors, all leading to the same room. That room is your dog's internal state at rest, and you now have a key to it. I think about Biscuit and Marlene sometimes. Biscuit had surgery. The mass on his spleen was removed, and the pathology came back as a benign hematoma, not cancer. He was lucky. Marlene was lucky. When I called her with those results, she cried for a few minutes and then said something I've never forgotten. Why didn't anyone tell me this sooner? That question is the reason I make these videos, not to replace your vet, never that, but to fill the 30 minutes your vet doesn't have. Biscuit is 9 now. Marlene sends me a photo every few months. He sleeps on his side, sprawled out, completely relaxed. The best possible sign. If all of this feels like a lot, I understand. Don't try to memorize every position and every condition. Tonight, just watch. Watch how your dog settles in. Notice if they look relaxed or braced. Notice if they prop their head or curl tight in a warm room. Notice if anything looks different from what you remember 6 months ago. Write it down if something catches your eye. That one act, paying attention and writing it down, is what turns a pet owner into their dog's most effective advocate. If you have a friend or family member who has a dog and you think they'd want to know this, send them this video. That's all I ask. Everything I've shared today is general information based on current veterinary research and my clinical experience. It is not a replacement for your pet's individual care. Please talk to your vet before drawing any conclusions about your pet's health, and especially before any changes to their care. Your vet is your partner in this, and nothing I say from behind a camera replaces what they can determine with their hands on your animal.